understand your concern, but realize that the risk of sun damage is far greater than the risk of using a sunscreen with chemicals. That being said, there are some options that are better than others when choosing a sunscreen for your child. The first option is a hypoallergenic sunscreen. These are specially formulated to be less irritating to your child's sensitive skin. The second option is a sun block. These contain ingredients like zinc oxide and titanium dioxide that sit on the surface of the skin and aren't absorbed, so they're less irritating. The sunscreen should be applied about 30 minutes before entering the sun. However, sun blocks work immediately, so there's no need for the 30-minute wait time. The third thing you should avoid when choosing a sunscreen are ingredients called PABA and oxybenzene. These are known irritants that can cause skin rashes. Remember that no matter how dark your skin is or how easily you tan, sun protection is still necessary because you're still at risk for sun damage.
I can't overemphasize the importance of using insect repellent this summer. People worry about insect repellent because of the most common active ingredient. It's called DEET. Now people worry because there's a report that DEET causes seizures. The risk of having a seizure when you use an insect repellent that includes DEET is less than 1 in 100 million. The American Academy of Pediatrics endorses using DEET up to 30% concentration on infants and children. Now, no one under the age of 8 weeks should be using an insect repellent on their skin, but anyone 8 weeks and older can use 30% containing DEET. And finally, this is my most important piece of advice. Never use a combination sunscreen insect repellent product. The reason is you need to put that sunscreen on every couple of hours. But if you're using a combination product, that means you're putting your DEET on every couple of hours as well. And that's too much. Put long clothing on your body, and if you can't do that, go ahead and use the DEET containing insect repellent. Better to not be bitten by the wrong bug.
Should you find that your child has an allergic reaction to a chemical that you applied to the skin, there are a few things that you should do. First, rinse all areas that the product was applied to with cool water for 15 to 20 minutes. Check with your pediatrician to determine if your child is old enough to take an antihistamine. Do not apply other lotions to try to soothe the area until the rash completely goes away. If you must use a product containing chemicals, do a small patch test on the inside of your child's arm to see if any irritation occurs 24 hours before fully using the product. By knowing about the products you're using on your child ahead of time and knowing how to handle adverse reactions, you can better control these situations so you can get back to the fun.